Hello and welcome. I'm Karen Burgess, and I'm glad to see all of you here. I can't wait till next year when we can be together. I've been on the People's Community Clinic Foundation Board since 2009, which I think is the year that it started. And I had served on the operations board briefly before that. From the like many of you, from the first time I heard about People's Community Clinic, I was drawn to its mission to bring high quality healthcare to Central Texans in need. And the more that I've learned and the more that the clinic's work has expanded to address the growing population of uninsured and underinsured in our community, the more I want to do. And I know that's true for each of you, especially in this year of unprecedented vulnerability in healthcare and health. People's has tackled those challenges in incredibly creative ways, and we're going to learn about some of that today. Now, I want to thank you each. Thank you each for taking time to be here. I want to thank you for the mission that your gifts so generously support. We host this event for that purpose, to update you on the work that you so generously support every year. And next year, hopefully, again, we'll be in person. Your gifts actually make People's itself possible. Many of your names were on the slides that we saw at the beginning, and I'd like to add a few special thank yous to the St. David's Foundation, to the Episcopal Health Foundation, to the Michael and Susan Dell Foundation, and to St. David's Medical Center. And we have a great program for you today. We're going to kick it off with Dr. Louis Appel. You probably will recognize him. He's the Chief Medical Officer of People's Community Clinic and has been for as long as I can remember. And then Cherelle Vanbrakle, who is new to me and a real treasure. She is Director of Health Promotion and Community Advocacy at the clinic. They're going to be updating you on how the clinic has met the challenges of COVID this year and continues to do so as the crisis continues. And then we're going to hear from Dr. Jeff Hutchinson, also maybe new for some of you. He was new for me, but wow, he is a thought leader in so many areas. And he's going to talk to us today about health equity, a better analogy. Now, throughout all of this, the chat is available. So I hope that you'll add questions, and I can bring those up as we get to the question and answer portion of both of these segments. So with that, Dr. Appel, Ms. Vanbrakle, if you guys could come on screen, join me on the virtual stage or the screen, and take it away. Tell us about what's going on at the clinic.
Great. Well, thanks, Karen. So hi, everybody. I'm Louis Appel. And for those who've been associated with the clinic for a while, notice I look a little different. The beard was a casualty of the pandemic. For the N95 mask to fit, I can't have facial hair. So I am, one of the things I'm really looking forward to is being able to grow my beard back when this is over. I want to thank you all for attending today. For those of you who are Star Wars fans, happy May the 4th be with you day. I'm a Star Wars fan, so I enjoy some of the Star Wars stuff. On a more serious note, I want to take a moment just to acknowledge what's going on in India right now. I think for those who have friends and family and loved ones in India, I just know that we are thinking of you and them, and our hearts go out. It's a really devastating situation over there right now. We have a number of staff who have links to India, and I know it's been a very hard few weeks for all of them. So coming back, I want to just thank you again for being here. All of you are incredibly important supporters of PCC's work, and I really want to thank you for that support, particularly during this past year. And for many of you for a number of years prior to this past year. As I'm sure they've been for you, the past 14 months have been incredibly challenging for the clinic and for our patients. And Dr. Hutchinson's going to be talking about health equity here shortly. And I just want to mention, and as we talk about the challenges of the last year, that the populations we serve at PCC have been particularly and disproportionately harmed by the pandemic and its consequences. Your support has really been critically important to our ability to meet the challenges of the pandemic, and your gifts have made a real difference. I don't have to tell this group, but from its founding, People's has been dedicated to providing high quality healthcare with dignity and respect, and empowering patients to take control of their own health. That commitment is part of the clinic's DNA, and it's been even more important during this crisis. In my few minutes visiting with you this afternoon, I want to share a little about how the clinic has responded to the pandemic and then provide some quick updates about our current efforts related to the COVID vaccine. So we started preparations for COVID in January of 2020, but when it hit in March, there really wasn't a playbook for exactly what to do. We had to utterly change our ways of seeing and serving patients in a matter of weeks. We had to drastically reduce seeing patients in person to reduce exposure risks. And we had to deal with terrible shortages of personal protective equipment. In fact, in one of the early weeks, we were down to our last pack of gowns, literally a handful of gowns, before being gifted some from one of the hospitals and another clinic. We went months having staff reuse N95 masks for weeks at a time because of the lack of supply. And we were even short on basic surgical masks and advertised on the clinic's social media for masks, as you'll see on these slides. Through the pandemic's early months, individuals, businesses, and others donated thousands of masks to the clinic. In fact, one of our physicians in this family even made face shields for clinic staff during the worst of the pandemic. Despite the challenges, the clinic has been fully operational throughout the pandemic, offering comprehensive primary medical care, integrated behavioral health services, wraparound programming, and COVID-19 testing, and now COVID-19 vaccinations. Two of the biggest changes in how we provide care have been instituting drive-up options for some care and implementing telemedicine. So I want to talk about those for a moment. We started early on with drive-through testing for COVID to reduce risk for patients and staff, and later added strep and flu testing. At our Center for Women's Health, we instituted drive-through birth control injections. And during the fall, for the first time ever, we provided drive-through flu vaccine. And you'll hear about this more from Cherelle in a moment. Because this is PCC, at one point in the fall, we helped people with voter registration using our drive-through infrastructure. We also pivoted to telemedicine within weeks to reach patients where they are and reduce the need for patients to leave their homes and come into the clinic. As you know, the pandemic has laid bare many inequities in our society, and having access to broadband internet for video-based visits is just one of those. So although we did quickly stand up a platform for full video-based visits, many of our visits have needed to be phone-based. Peoples currently offers telemedicine visits across all our medical departments, as well as remote behavioral health visits and health education visits. In adult medicine, at the height of the pandemic, telemedicine made up 60% of our visits. We've also adjusted the way that we work together as a clinic. Peoples has equipped staff with computers, chairs, other equipment so that they can work remotely. We've implemented a weekly online town hall meeting for staff to discuss the pandemic, where we can get feedback on how procedures are working or can be improved, and to support one another. We also instituted a virtual resilience workshop for employees that's once a month that allows our staff to attend and provide some helpful ways to deal with stress. And I've really been in awe of the way that our staff members have come up with highly creative ways to convert in-person programs to online programs. For example, our early childhood development staff created a series of short videos for our social media for kids to encourage reading and also to make fun crafts. We've also converted our integrated pain management program and other programs to virtual forms. So shifting gears now to where we are today, thankfully, and really amazingly, a year into this pandemic, we're now vaccinating our patients against COVID-19. So earlier this year, our ability to get vaccine supply was quite limited. We initially partnered with Austin Public Health to get access to the vaccine for our patients, but as supplies have improved, we've been able to provide a vaccine directly. Again, inequities come into play. Throughout our community, the initial priority was getting as many people signed up as quickly as possible for vaccine, and this meant text messages and online registrations. We quickly learned that was not working well for our patients. We made individual phone calls to all our patients 65 years old and older. And while we still have depended quite a bit on text messages to let patients know they can get vaccine at PCC, we encourage them to call us to schedule their vaccine appointment rather than requiring them to use an online system. There are challenges with vaccine hesitancy, but honestly, a lot of what we encounter are patients with questions. And vaccine hesitancy really is about trust, or a lack of it, in the healthcare system, often with good reason and based on past experiences. Because our model of care is built on developing relationships with our patients, we're well positioned to be a trusted resource to answer our patients' questions and help them make an informed choice about vaccination. Another part of our effort around the vaccine is partnering with UT's College of Communications in a study to look at the best ways to communicate with different populations about the vaccine. We're currently able to offer a vaccine to all our patients 18 years and up, and we're about to implement a scheduling platform that will allow us to open our vaccine efforts to the broader community beyond just our established patients. In anticipation of that systems coming online, we're already in discussion to partner with community groups, churches, and other agencies to vaccinate their members, as well as do other outreach in the neighborhood around the clinic. Our approach, including going the extra mile to reach our patients, providing a person and not just an online platform for scheduling, and partnering with different community organizations, all of that would not be possible without the support of those of you with us today. So again, I want to thank you for your longstanding support of the clinic. Now, I'd like to turn it over to Cherelle Vanbrakle, our Director of Health Promotion and Community Advocacy, who's been a real leader in our response to COVID-19. And she's going to talk more about our community outreach and what we've done to address social needs during the pandemic. Cherelle?
Thank you, Dr. Appel. Hi, everyone. I'm Cherelle Vanbrakle. I'm a mom, a daughter, a sister, and a friend. And like Dr. Appel said, I'm Director of Health Promotion and Community Advocacy here at Peoples. Many of you know Peoples for its excellence in healthcare, but you may not know that our work extends beyond the clinic walls. My personal motto is to get the community in the room where it happens, which is a Hamilton pun. About 6 years ago, I started a new job in healthcare, and I was also pregnant with my first daughter. I was in a meeting with healthcare organizations in Austin looking at MAP data on Black maternal mortality rates. My zip code was highlighted as where rates were high, and I began to kind of freak out because I was pregnant at the time. The group began to talk about solutions, and unfortunately, I was the only Black woman in the room, but didn't feel like I could say anything because I was so new to the job. This particular experience constantly pushes me to be led by the people that we serve. Another key to doing this type of work is to just be kind. We're all human beings, and part of being kind is listening to others, actually listening, not just hearing. So if we listen to others saying the system is not working for them, that it's not built for everyone, let's see how we can change it. This is the thread that is woven through all the work that we do here at Peoples. It's very important that Peoples is truly represented by the people that we serve. That's why half of People's Volunteer Board is made up of patients, and the other half is community representatives. People's actively solicits patient community feedback on programs and initiatives, and is also actively engaged in incorporating patients and community members into advisory and leadership positions. People's approach focuses on community engagement, screening for social determinants of health, and participation in a regional community-based referral network. We have a reputation for being innovative in how we help our patients address their social drivers of health, including integrating our medical legal partnership, as well as screening for social needs and fostering community empowerment. We understand that our patients are prioritizing different things, and we need to work alongside them to understand what they are. As an organization, People's Community Clinic has power. It's how we can utilize that power and how we can empower our patients to work alongside us to push for the change that we know needs to happen. The Department of Health Promotion and Community Advocacy uses something called the spectrum of prevention, which looks at strengthening individual knowledge and skills, fostering networks and coalitions, changing organizational practices, and influencing policy and legislation. We really strive to increase civic engagement and civic literacy as a part of this implementation of the spectrum of prevention to create policy and legislation change. Specifically through block walks and house meetings, we're constantly seeking feedback from people we serve, from the community and partners to understand our needs and how to incorporate these needs into our system. The clinic has even trained about 25 staff members to volunteer and be volunteer deputy registrars to register patients, friends, and family to vote, as well as worked with League of Women Voters to do voter education sessions on things that were on the ballot. We also have conversations with patients who might be ineligible to vote about helping in some other way, like giving a ride or relaying information. People's developed a process to assess social determinants of health. The data helps to inform advocacy efforts as well as programs. In social needs screening, it's not okay to just ask the questions about needs, but we have to be action oriented. With input from community members and our own interdisciplinary team, People's created a unique survey for social needs like transportation and housing. This survey, created in both English and Spanish, was designed to meet the clinic's specific patient population. Results from the survey have gone on to change our processes. For example, prior to the pandemic, after an initial test of about 2,000 patients, preliminary data showed that ESL classes, English as a second language, was something that our patients really wanted. So we worked with Austin Community College to set up those classes here at the clinic. Unfortunately, we weren't able to have those classes due to the pandemic, but we have been able to keep that partnership and refer our patients to ESL classes that ACC is holding online. In order to remain responsive to the community needs during the pandemic, we modified our social needs screening tool and sent text messages and emails to all of our patients that we've seen in the last 3 years. Our nurses also screened over the phone when calling patients with COVID-19 test results. For those patients, we made sure that the resources that we provided gave them the ability to quarantine. This data showed that the most of the needs were utilities, technology for online learning, housing, and food. People's team jumped into action to expand resources in these areas as well. An example, People's established a partnership with Austin Urban Technology Movement, whose mission is to get people of color in the tech industry. People's can now refer patients to Austin Urban Technology Movement to help them get a laptop for remote learning. Additionally, they also trained their clients, and so our patients, to earn Google certifications, which a lot of tech companies are using as a qualifier instead of a college degree. Even COVID-19 could not stop our efforts to promote civic engagement. As Dr. Appel mentioned, we switched to a text campaign and took over the COVID-19 drive-through and did a drive-through voter registration for patients as well as the community. Preventative measures take a long time to prove, but over time, we hope to show that these preventative measures, each patient's needs are connected to positive health outcomes. We hope our data will show when patients spend a certain amount of time with a community health worker, they will achieve positive health outcomes. And currently, my biggest focus is evaluation of these programs and this prevention model. I'm working to show that the community health worker program can increase a patient's self-efficacy, and there's already existing evidence that shows that increased self-efficacy leads to increased health outcomes. And by showing this connection, we hope to be able to increase our funding for these type of prevention programs and also empower more people. Thanks, everyone.
Thank you, Cherelle. Thank you, and thank you, Louis. We're going to take a few minutes to get some questions, and I welcome those from the chat box. I'm going to start with some that were submitted beforehand. We talked a lot about medical needs during the pandemic. What was the area of most need beyond medical needs, and how has People's reached out to address that need?
Yeah, I can answer that question. So I mentioned a little bit, but the top 4 needs during the pandemic that we've seen when screening our patients have been food, utilities, technology for online learning, and assistance with rent or mortgage support. So our team has done quite a few different things in those realms. Obviously, we helped at the individual level with patients getting those resources, but we were able to advocate at larger levels around some of those issues. So our community health worker actually advocated at the city level to increase RISE funds, which was a fund that the city was putting money into for direct assistance, to direct financial assistance to individuals. And that was actually able to help out quite a few of our patients who were just able to get direct funds from the city. Our medical legal partnership team also led a statewide effort to help with utility cutoffs. So they drafted a protection on utility cutoffs that actually helped the entire state. So we're very proud of some of the things individually and at a larger scale that we've been able to do.
Wow, well, thank you so much. And Dr. Appel, you mentioned vaccine hesitancy, and what have you found to be effective to try to reach out to those who might be hesitant in people's?
Yeah, thanks. So as I mentioned, I think most of what we've encountered are people who have questions, particularly those who have underlying health conditions. Even though they are folks who are at higher risk if they get COVID, they tend to have questions about whether, because they've got underlying health conditions, it's okay for them to get the vaccine. So we see a lot of that. And like I mentioned, to the extent that we've encountered real hesitancy, it tends to be a matter of trust or lack of trust in the system based on people's past experiences with things that have happened to them in the healthcare system. So I think it's understood and reasonable apprehensions that people have. So I think one of the big things that we do is to be a trusted source of information for patients. And we're not trying to force people to get the vaccine. We want to provide an opportunity for them to get their questions answered, to provide them with good information, and to help them think about the risks and the benefits, not just of the vaccine, but the risks of contracting COVID and the risks of that if you get it. One of the things that we're focusing on now is phone outreach. So we did real intensive phone outreach for our patients over 65 early on. We're now expanding that out to do phone outreach to a broader group, the sort of full group of patients who are now eligible, which is pretty much everybody 18 and over, to try to provide that opportunity for people to ask questions to help them make an informed decision. We're working on being able to expand that. Some of the federal dollars that were approved recently as part of the COVID relief package are going to allow us to hire some additional staff who can focus on phone outreach and broader community outreach. So we're looking forward to being able to hire those positions in the coming weeks. We're also really focusing on discussions at visits. So when patients come in for their appointments, that's a prime time to be able to talk to them about vaccine, answer their questions, have them actually be able to have a conversation with their provider, which a lot of people want to do. And we've been really encouraging our providers and the nursing staff when they're having phone conversations with patients about other things, test results or other things like that, that they talk to them about the vaccine. And then our development team has done a great job of providing us with nice, attractive posters that we put up in all the exam rooms that encourage folks to get the vaccine and ask about the vaccine. And when folks come in for their vaccine, our development folks also created these very cool photo backdrops for selfies so that people, when they get their vaccine, can take a picture of themselves with this photo backdrop that they can then send out to their friends and family to encourage others to get the vaccine. So I think a lot of it is really sort of once as we're getting past the folks that are very much want to get the vaccine, it's really more about providing more kind of, and politics, you would say retail politics, I guess retail medicine, like really reaching out to people and making connections and talking to them.
Thank you, Dr. Appel. It's too bad you can't give the vaccine over telemedicine.
That's true.
We're getting some great questions in the chat. The first one just goes straight to the bottom line, literally. The chatter says that she noticed that revenue dropped significantly over the past year. Is PCC getting any benefit from recent federal aid legislation?
Yeah, I can talk to that some. Yes, we are. So, and I would say also during 2020, the PPP loans were very important and helpful to us for maintaining our staffing levels. And with the most recent relief funds, we're we're still working through all of the budgeting and stuff related to that, but it's going to provide significant support for the clinic, in particular around the vaccination efforts. So we are in the process of hiring for a coordinator who can spend all their time really focused on the vaccine effort right now. Our clinical director is spending much of her time on that, along with all her other duties. So we have kind of more coordination coming. As I mentioned, we're going to be able to hire people particularly for outreach, to both with community outreach, to help with phone outreach. There's a lot of preparation and data entry needs around the vaccine that we're going to be able to get some assistance with. And we're also looking to actually create kind of a mobile team that'll be able to do some do vaccine out in partnership with community groups and organizations. And so all of that is in the works from the recent assistance that's coming through the pipeline.
Well, your answer is great, but it also gave rise to some more questions in the chat. One is, it sounds like that would give rise to a lot of volunteer opportunities. Are there opportunities for people without a health background or training to get involved in some of the actions you just mentioned?
There definitely are. So we do have a volunteer coordinator who is able to take requests from folks who are interested in volunteering. Tashira is wonderful at hooking people up with the different opportunities we have at the clinic. For the vaccine effort in particular, we have different roles that don't necessarily require medical background, just kind of helping people navigate. And we're doing a lot of the vaccine stuff on Fridays and on Saturdays. And so yeah, we can make sure that we get out to this group contact information for Tashira, our volunteer coordinator.
Maybe we can even get that in the chat right now. So that would be great if we could. And also to the point that you made earlier, how does an individual donor's donation help people's with public agency funding?
I'm sorry, I missed the last part with public
agency funding. Is it similar to grants where money begets money?
So all of the funds are incredibly important. I would say the philanthropic dollars that we raise, in particular from individual donors, are extremely helpful because they're very flexible, and so we're able to use them where we see the most need. And while there are a lot of dollars earmarked for COVID-related stuff, there have been a lot of pressures and stresses on the rest of the system that's not related to COVID as well. So we've had many, staff that have had to be out. We've had a lot of staff shortages because they've had to cut back on time in order to be home with children who are at home for school and all of those types of things. So the philanthropic dollars are of huge importance to us because one, they're dollars, and two, because they're very flexible. So they help us quite a bit and are really important to our work.
Question from Phil Dial is, what is the reasonable goal for the vaccination rate among our patients, and how long will it take to reach that level?
Yeah, I can talk a little bit, and then maybe Cherelle can talk a little bit about some of the organizations she's been in touch with, who we're thinking or hoping to be able to partner with as we're able to expand out beyond just our patients into the broader community. For our patients, I don't know what that level is going to be. We don't have a great handle right now on our immunization rate among our patients because we have we have very good tracking of the patients we have given immunization for, but for the first multiple months, we were really working to get our patients in through Austin Public Health and access to vaccine through others when we didn't have a very good supply. And so we have a lot of patients that have gotten vaccinated outside of the clinic, and we're working on getting their information into our system as we learn about the fact that they got vaccinated. But so I don't have a great sense of that. We have about 85% of our staff vaccinated, which is excellent, and we're excited about that. I am hopeful that we will be able to get, 70 to 80% of our patients vaccinated. But I do think that probably is going to take a while to get everyone comfortable. And Cherelle, do you want to talk a little bit about some of the organizations you've had conversations with?
Yeah, I can. So we have had minimal conversations. I think throwing out some ideas on how we could possibly collaborate with some community-based organizations and some grassroots groups that are doing work in communities that we serve, including the community directly surrounding the clinic. So talking to those apartment complexes, as well as the St. John Neighborhood Association, as well as the city of Manor, who have not had as much ability getting their hands on vaccines for those residents. And we have a school-based clinic there. So those are two, the neighborhoods directly surrounding the clinic, city of Manor, as well as folks like Foundation Communities are some of the organizations that we've had some conversations with, and they're really interested in getting their residents and our clients access and the ability to have some conversations, like Louis said. There is a need for just the conversation and to be able to talk through those questions with individuals. And I think that there's a lack of that. So we're hopeful that the outreach workers that we're bringing on will be able to increase the amount of time we have to have those conversations.
And Cherelle, while you're on our screen here, at least on mine, have recovery efforts and the state's reopening had a positive impact on patients, or is their recovery at a different pace? Also from the chat.
I think that's a really good question, and it affects the patients differently. I think we've seen both positive and negative impacts on our patients. For some of our patients, the reopening has given them the ability to have more hours and be able to work more. But in the same breath, a lot of individuals who work on the front line have not had as much access to vaccines, and so our community health workers, for the individuals that they are working with and having interactions with, the vaccination conversation is important as well, especially because many of our patients work in construction or in warehouses or like in the service industry. And I think that industry was hit very hard in both not being able to work as well as not having access to vaccines currently.
What about younger patients, adolescents? I know that the clinic has a lot of focus on adolescent medicine. Will they have access to the vaccine once it's approved? Also from the chat.
Yeah, great question. So yeah, we've been working on that, and we are planning to make it available to younger patients. Right now, the Pfizer vaccine is available for 16 and 17-year-olds, and some folks have probably seen the headlines that it's anticipated that that'll have approval. The Pfizer vaccine will have approval to go down to 12 years old, perhaps as early as next week. So the Pfizer vaccine is a little bit more challenging to handle logistically and from some practical standpoints. We mostly have had the Moderna vaccine. The Pfizer vaccine, for the level of freezer that we have, we can only keep in the freezer for 2 weeks. And then once it's out of the freezer and in the refrigerator for 5 days. So it's got much tighter kind of use restrictions around it. So we haven't been focusing on that one. But as this expansion occurs to younger children, we are planning to order Pfizer vaccine, and hopefully within the next 3 weeks or so, we'll actually be able to start doing vaccine for younger kids, and if it's approved, down to 12.
And it's going to have such a ripple effect on schools and the patients being able to get back to work and all of that. It's really exciting. And thank you so much. Thank you, Dr. Appel. Thank you, Cherelle Vanbrakle. I look forward to actually meeting you in person, and even though we're all in the same place in different rooms, but but I really appreciate it, and I appreciate all you do every day. And thanks to all of you for the great questions. That's a lot of fun, and we're going to keep them coming because now, hopefully on your screen is Dr. Jeff Hutchinson. And Dr. Hutchinson practices adolescent medicine, speaking of, at Peoples. He is a thought leader on diversity, inclusion, organizational conflict resolution. You could put me out of work, Dr. Hutchinson, and leadership itself. And you are going to see why. Dr. Hutchinson is here today to talk to us about health equity, a better analogy. And after he's given us a short presentation, he too is willing to stay and answer questions for us. So, so thank you, Dr. Hutchinson. We're glad to have you.
Thanks, Karen. Thank you for the introduction. It's very sweet. I'm so happy to be here today. And I've been at Peoples for 2.5 years, and I can say there's no place else that I would rather be. Peoples is a home, is a community, is a place that really this past year has shown that we care about not only our patients, but about each other. And I'm so privileged to be able to share my perspective on health equity. Now, I too miss the times that we're together, because this conversation really is so much better when we're able to look at each other face to face and have that conversation. But we're going to make do. And I'm going to keep it going by getting you to interact a little bit and sharing some of the thoughts and ideas that you may have. Now, anyone who has more than one child, who has nieces and nephews, you understand the concept of equity, not equality. Equity is when you give people what they need, you realize where they are, what their needs are, and you provide for them their actual needs. People with children understand that we're not all the same. Now, the common analogy that people use is a graphic by Craig Froley. He made this graphic of 3 children looking over a fence to be able to see a baseball game. The idea that if each child has a box, 2 of them can see the game, but 1 is not tall enough to see over. So to be equitable, you move 1 box to the child who needs it, and now everyone can see. That's the idea of equity, supplying what's needed. People have run with this image. They have gone to other links to try and better explain what equity is. And Angus McGuire, he came up with a picture instead of children to include an adult and to include people of color. So the next slide shows Angus McGuire's image looking at the baseball field with people of color. The Robert Wood Johnson Foundation took the idea of equality versus equity and used bicycles. I like this one a little bit more because it shows action. It shows that people are actually doing something. But the idea is still that not everyone gets the same thing. Everyone gets what they need. Other organizations have thought about whether you reach for an apple out of a tree. If you can get something, the only way to do that is to supply more resources for the person who may not be able to reach that tree. And the childhood image that most of us are familiar with of the giving tree, people have used that to also give a better example of what equality versus equity versus justice might be. So keep those in mind. I want to go back to that original image by Craig Froley. And I want you to look at all of the characters here. So it's not just the children. It is the people in the stands. A survey, a poll is going to come up now. And I want you to think about, in society, where are you? Are you a spectator in the stands who paid for your ticket? Are you a ball player on the field that influences everything, influences other people? Are you one of the umpires, one of the people who keep the rules and keep the game going? And I personally think of us as physicians and healthcare providers as more one of the umpire type people. Or are you outside of the normal resources within the stadium, looking in, tall child who can see, a child who's in the middle who has a box and is able to see, or one who doesn't have the resources to even participate in society? As you answer these questions, I'm going to pull up the results. And if I think what I'm expecting to see, most of us fit into category B or even A or C. And that's why I think that this particular analogy does not quite fit what we need to do and what we need to focus on for talking about equity. So, as I thought, more and more people picked an umpire. So a lot of you feel like you help keep society, help keep things going. Very few people chose one of the children. And that's one of the problems with this analogy. As we close this poll and go on to what I think is a better analogy, what's missing from any of these other pictures is the idea of working together. I had my son draw this graphic. I was inspired by a water commercial from France that showed people pedaling a bike and giving power to an animation so everyone could enjoy it. What this analogy uses and shows is that we have to be a little interdependent upon each other. In the other analogies, it doesn't matter if someone else could see. It doesn't matter if someone else could get the fruit. What I did didn't impact anyone else. But in this analogy, you see that every person provides power. Every person is critical to make something happen. And I think that's what gets us to move more towards a feeling of equity, the ability to see what other people are doing, the ability to realize that what I do directly impacts what someone else does. So we know society may not be able to supply every machine that's possible. We know that society may not have a bike or an apparatus that allows us to contribute the power, and that may not be in our purview. But we know that we may have a better ability to contribute, to add power when given the right equipment. So I want you to look at these figures again. Some may show that you have a disability. And I'll use my own example when it comes to the housing prices here in Austin and the homeless situation. I feel powerless for most of it. I can vote, I can give to individuals that I see, but my power in changing the whole system and contributing is not as great. But with my past experience as an admissions committee in a medical school, I have great power to help individuals and to even help the system change in getting people into medical school. And I can say, honestly, could I do more? Absolutely. There are people who I could help far more than I'm doing now, so I have excess capacity. Think about you as the green person. What makes us contribute more? What makes us give more of our time, of our energy, of our power? The next slide are some examples. In the chat, I want you to maybe put a few things that apply to you, that you think would help you contribute more to a given situation. Is it because we see the benefit for ourselves? It makes us stronger, it makes us better. Is another reason because we all have a shared goal and we know that the more power we contribute, the sooner we can get to that goal. Is it knowing our potential? Do we feel sometimes like there's more that we can do, and when we realize we can do more, we actually contribute more? Or seeing others' efforts? Is it a competition? Because we know competition is a great incentivizer for a lot of us to do more. Self-improvement, and sometimes even negative feelings can make us do more, like we feel guilty knowing that other people are working hard and we could work harder. All those things are part of the motivations that help keep us going when we know that there is an interconnectedness, when we know that what I do affects you and what you do affects me. So let's go back to that image again. There are a lot of things that can help us decide how much effort we're willing to give. There are a lot of situations where we know that our effort, we're just barely hanging on, or we can give more effort. And it's up to us to try and maximize our own potential. I'm going to end my part of this in the time I'm speaking by telling you the time when I realized the importance and the reality of equity versus equality. In 2004, I was an executive officer for a military mission to the Honduras. Our role was to help the Honduran government evaluate their population and to help them get to places that they may not have been able to get to as easily. We didn't come in as saviors. We came in asking them, how can we help you? During that time in the forest, in places away from the city, there were people who barely had roofs over their heads, and we would exchange salt. We would take some of their salt to analyze and give them iodized salt. We would take some of their flour and give them an enriched flour, and realize that some people really had barely anything, as opposed to within the city where there were hospitals and providers and equipment available, but even some of the equipment didn't have the electricity or the parts needed. So each person, each situation needed something a little bit different. And that made me realize the difference between equality, giving everybody the same thing, versus equity. And my hope, my goal, my plea for all of us is to try and be as equitable as we possibly can. So thank you, and let's open it up for questions.
Thank you. Thank you for your service, and thank you for your continued service. It was really insightful and inspiring, and I am sure that we'll have more questions. We welcome those. To get us started, Dr. Hutchinson, how can it, kind of actually going off a question we got from the chat earlier, how can we as folks who are not healthcare specialists, who are not professionals, how can we contribute or support health equity?
Excellent. So health equity is so much more than what happens in the clinic. Health equity has to do with where you live, with clean water, with healthy food, with green spaces. There are so many things that go into us being healthy. Things I tell patients all the time. There are 4 things that keep us healthy: eating, sleeping, exercise, and managing stress. If you have any ability to help other people to address those things, then you can contribute to health equity. If you're in a leadership position, removing the barriers, knowing that having buses or having new construction or having something that takes away any of those opportunities for people, that affects health equity. So whatever we can do to increase opportunities, to remove barriers, and most importantly, find out what people need, just like in Honduras. If I went in saying, I know what you need, and here it is, that's very different than them saying, this is what we need, how can you help us?
I'm listening here. So, you know that saying about if you can dream it, you can achieve it. Well, help us dream it. What does health equity look like in the real world with examples?
In the real world, health equity would mean that you couldn't look at someone's skin, someone's language, someone's external qualities and say, I can predict what's going to happen to your health. The most graphic example here in the US is maternal morbidity and mortality, as Cherelle mentioned. And with a 2.5 times greater risk for Black moms to die during childbirth, health equity would be, you couldn't make that determination. It would not matter that you wouldn't be able to see that Black moms have a much greater risk of dying. We talk about zip codes determining health outcomes. That would disappear. All zip codes would have very similar health outcomes. And that is the goal of health equity.
It's a good dream.
It is.
Thank you for working towards it.
Mm-hmm.
Now, this is from the chat, in the analogy of the baseball field, what's the difference between the tallest kid outside the fence and the spectators?
Excellent. So a lot of people don't like that analogy because they see themselves as the spectators. They paid for their place in society. They have access to the concessions and they belong there because they sacrifice something, compared to the children outside, able to enjoy the game, able to be part of it without sacrificing anything. So a lot of people have trouble with that. The spectator in that analogy is someone who society says you contributed, you paid your ticket. The children outside, society will look at, well, you haven't paid your ticket. You may not deserve to watch the game. And that's what I'm trying to eliminate, because if we are really all on the same team, all on the field, all working together, then we know inherently that everyone deserves to be part of the game.
Now from the chat, we're asked, what are some of the ways that health equity is compromised in our current system?
So health equity gets compromised when resources are unevenly distributed. Who makes the decisions of where the resources go is very, very complicated, from insurance to the history of our country, to history of redlining. All of those things contribute to health inequity, and all of those things require a lot of effort. It requires us from just relaxing on a bike to getting on a treadmill and working harder to add additional energy to make a difference for the people who may not be equally able to change their environment, to get the resources that they need, to see the benefits of being part of a healthy society.
Well, thank you so much, Dr. Hutchinson, and thank you to Dr. Appel and to Cherelle and to all of you who have taken time out of your day to attend this time together. I know I have gained a lot of insight about how Peoples has met this challenge of COVID. And we all know that your support makes all the difference. Of course, that work absolutely never stops, especially as the need continues to grow here in Central Texas. If you haven't already, please consider renewing your annual gift or even increasing your annual gift, because it's a really important time for it. Not everyone has been impacted the same way through this crisis. And you can do that on the website, or you can text Crush COVID to 41444. Please also follow the clinic on social media, on Facebook, Instagram, Twitter. You're going to get all the latest news on healthcare and People's Community Clinic there. Monica's going to put a link in the chat to get to the website if you prefer that to the text option. Now with that, thank you so much. And I can't wait to see you all in person next year.